Hi, Dr. Harrison here, and in this video I want to discuss spinal decompression. Spinal decompression is what we utilize in the office to help people avoid going through a back surgery. And so typically we're using this modality for disc bulges, herniations, and what we call an extrusion or a prolapse. And in order for you to understand the differences between those, I want to talk just briefly about the anatomy of the disc. So when you're looking at a disc, you've got a circular fibrocartilage ring or rings. And so the outside of the disc, which they call the annulus, is multiple rings of fibrocartilage. And they run in a circular pattern at different angles to one another. And that annulus, or the outer fibers of the disc, are very, very strong. And they're what attach to the vertebrae above and below it. So the disc sitting in between the vertebrae, and those annular fibers are connected to the vertebrae above and below. The central portion of the disc you can kind of think of like a jelly donut. It's made up mostly of water and some sugars and some other enzymes, and they sit in the middle of the disc, and that nucleus, they call it, serves as kind of a fulcrum, so that when the disc is sitting between the vertebrae, if you want to bend forward, backward, side to side, well, we're pivoting around that nucleus, which is the liquid middle portion of that disc. So in a healthy disc, the annulus is intact, the nucleus is intact, and everything's functioning, quite normally. When we run into problems, when we have a disc bulge, for example, what that means is that probably the nucleus is starting to lose some of its water content. And what I mean by that is kind of like when you start to let the air out of a tire, you'll see the outer edge of the tire start to bulge out. Well, that's what's happening with a bulging disc. You're losing some of that turgor or water pressure in the nucleus. The vertebrae start to collapse on one another, and that disc starts to bulge out. Well, when it starts to bulge out, you can obviously irritate muscles, ligaments, nerves in that area. And so many times with a disc bulge, you might get numbness or tingling or pain down the legs. Sometimes it's just in the lower back. The good thing about the disc bulge is it usually responds very, very quickly to the spinal decompression. The second most common type, we talked about the bulge already. Well, now we're going to talk about the herniation. And the herniation is where some of those annular fibers, that fibrocartilage ring, have torn. And now the nucleus is starting to migrate through that tear. And usually it's going to be posterior and lateral, and that's why when people come in with disc herniations, many times we'll see them, antalgic, we call it, or leaning to the left or to the right, depending on which direction that herniation has traveled, either posterior and lateral left, posterior and lateral right. Sometimes they'll interchange the term protrusion. So if you've been told you have a protrusion, that is a herniation, and the herniations are more likely to irritate nerves in the area, so much more common to have those radicular complaints of pain or numbness and tingling down the leg to the foot. So we always want to recommend, before going to a surgery, trying that spinal decompression, because what that spinal decompression does is it tractions the vertebrae above and below the disc, creating a negative pressure and trying to pull everything back towards the midline. So we're going to talk about that in a little more detail in just a moment. Let's talk about the third most severe type of disc injury, and that would be the extrusion, extruded disc, and sometimes even a free fragment. They will interchange the term prolapse sometimes in there, and that's where that nucleus has pushed all the way through the annular fibers, and now it's out into the canal. And when we get to that situation, if there is a lot of severe pain, those are the ones that are usually not a good candidate for spinal decompression. So it's important when we look at MRI findings, we rule out the possibility of extrusion, or sometimes even with the extrusion, a free fragment where part of the nucleus has become unattached and it's floating around in the canal. That's almost always going to be a surgical situation, unfortunately. So we always have to determine, which phase the patient is in before recommending the spinal decompression. One last thing I want to discuss, which is probably the most important thing, is that the discs in between the vertebrae require movement of the bone above and below it to get its nutrition. It doesn't have its own blood supply, so nutrition is transported from the vertebrae into the disc and then back out passively as we move around throughout the day. They call that process imbibition, and it's largely dependent on what we call a pump mechanism in the disc, and that pump mechanism is where the disc is pumping waste products and things out, and then passively back in, it's bringing in water, oxygen, and nutrients to stay healthy. But when we have a disc bulge or a herniation or an extruded disc, that pump mechanism has failed. And when that pump mechanism fails, that's when we start to see the continuation and the deterioration of that disc. So it becomes unhealthy. Well, what that spinal decompression does is it simulates that pump mechanism for us until that disc has time to heal. So it's pumping water, oxygen, and nutrients in and out of that disc, pulling out the waste products, putting in the good stuff over and over and over again. Typically, this process, if it's in a severe disc case, might take even 8 to 9 weeks of doing this spinal decompression 4 days a week. The nice thing is it's an outpatient therapy. The patients find it very comfortable. They're not going to be laid up or debilitated for any period of time like they would be with a surgery. And I should mention too, the outcomes are much, much better. 85, 90% success rate, much higher than your standard back surgery. So if you're suffering with a disc bulge, herniation, maybe you've been to a couple other locations and you're not seeing the progress that you want, or maybe you weren't familiar with spinal decompression, you want to find out more information, please feel free to call the office. Our consultations are always free. We'll sit down and I'll discuss with you at length, where you're at, bring your MRI findings so we can review those together and see if you're a good candidate for spinal decompression. I hope you found this information very useful, and I look forward to seeing you in the office.